Hi, Madison.
Hi. Cool. Are we ready to go?
Let me just check the YouTube stream. We're ready.
Okay, thank you for joining us in what is now, I believe, our 6th town hall. We've created these meetings pretty much almost weekly so that we can answer some of the community's questions regarding COVID-19, as well as providing some of the information that we have. So today we have Mayor Terry O'Connell on the call.
Hello.
And we also have myself, Madison Davis, Councilwoman of Brisbane, and we have many city staff members, and we also have Dr. Gupta here with us this evening. He joined us a few town halls ago, and he was a really popular guest, and so we're happy to have him back. He's a Brisbane resident, and so he is equipped to answer some of your more specific health-related COVID-19 questions. Of course, he's not a doctor and he doesn't know your situation and can't provide you medical advice, but he does have a lot of information about COVID-19, the information has advanced since a few weeks ago. So we're excited to talk to him about that. We're going to go ahead and get started here, and we'll just move to the next slide. So just a quick reminder about how the meeting will function. All participants will be muted except for city council members. If you do have a question, there is a raise your hand option. So you can raise your hand and we can call on you to answer that question. Better yet, there's also a chat box. So if you have questions at any time, you can chat in the chat box. That will go to our city clerk, who will then pass those questions along. And as a reminder, this meeting is live stream, so don't say anything that you wouldn't want your grandma to hear. We're going to go ahead and get started. There has been some updates regarding face coverings, so kind of just go over what some of those revisions have been to the order, and most of it's more of a clarification as opposed to a revision. It's pretty lengthy, so I would suggest if you have questions about all the fine details of the face covering requirement to check out San Mateo County Health, and their website will have the order in detail. But some things to note is that they updated the order to prohibit those face coverings that have valves. So you'll see a lot of those with a valve in the middle or a valve to the side. And what happens with those is that actually promotes people breathing out of the mask. And if they cough, those droplets then go into the atmosphere near them, and they can really impact those nearby, especially if that person with a covering does have COVID. And so those face coverings really aren't going to protect the people nearby from the person who's wearing them. So at this time, it is not recommended that you wear those masks. They're also saying that you should be wearing the masks anytime you're in line to visit a business, which all of us have been doing that so far, or if you are engaging in minimum basic operations at a business, say you're at work, or if you're receiving essential services from a government organization. Also, if you are participating in essential infrastructure work, you should be wearing a mask, and visiting the doctor or dentist, any sort of healthcare environment, you should be wearing a mask unless somebody that works at that healthcare operation tells you to remove your face covering. And then, of course, if you're ever riding public transportation or waiting for public transportation, or if you're riding in a taxi or rideshare service, you should be wearing a face covering at that time as well. And then people should be wearing them at work if they are in common areas such as hallways, stairways, elevators, parking facilities, or in any enclosed room with other people. If you have your own office, you can remove your face covering in your office, but that's only if the public's not visiting that office regularly. So there's a lot more details to this as well, but we highly recommend that you read the order in its entirety if you have questions. And then there were some other updates as well to other aspects of shelter in place. So we've moved into phase 2, but a kind of a phase 2 of phase 2. And that allows for a few more things. So you may or may not know that retail has opened for curbside pickup and delivery only, as well as manufacturing and logistics operations have been permitted to open again. Office workplaces can open as well, as long as there's still abilities for people to work from home. And they're suggesting that as many people work from home as possible. There's also some limited personal services that are now allowed, such as pet grooming, dog walking, car washes, residential cleaning, etc. Outdoor museums are permitted. Childcare is also permitted, not just for those of children that are of essential workers, but it's now open to all children. But you should understand the risks when you put your child in childcare. And then pools, some pools across the county are opening. However, locker rooms are not allowed to stay open. And then there's also provisions allowed for car parades. So people can, get in a car and have a long parade to celebrate something. But there's a lot of rules surrounding that, who's allowed to be in the car and so on and so forth. So again, for more specifics, we highly suggest that you read the order and then the appendices that go along with those orders for full information. So that's pretty much it for me, I believe. We'll go ahead and turn it over to Dr. Gupta, unless there's anything that staff would like to insert at this time. No? Seeing no. Okay. So thank you, Dr. Gupta, for joining us. Dr. Gupta is a Brisbane resident practicing pulmonary and critical care. And as I mentioned, he was on a previous town hall. There was a lot of interest around his participation. So we're really thrilled to have you back. And so I'll go ahead and turn it over. If you want to maybe, I guess we can just start with do you want to start with a Q&A, or how would you like to start?
Yeah, and actually I might begin with just a couple of key words or just thoughts and ideas that maybe takeaway messages as we make the move into this phase 2 of phase 2. It's exciting, I think, for a lot of us to think about the possibilities of going out to restaurants and not dining in yet, but having a little bit more mobility and freedom to go to parks and get basic stuff done. And I think the key thing as a healthcare provider and even discussing with our city leaders is that we still, all of us, have to take our risks and benefits in mind, what each of us are exposing ourselves to as we do those things. So, and what I mean by that is, if I am a senior citizen above age 65 and I may or may not have a health condition, I might be a little bit more cautious than someone who is in their 30s. And by cautious, it still means everyone needs to wear a face mask and do social distancing. But what I'm talking about is the liberties by which we say, hey, the gates are open to a degree now. I can go to see people, I can see my friends, and so on and so forth. But there still needs to be that modicum of the pendulum has shifted, and that's because the models have shown us that the big surge, perhaps we're at a place now that the big surge may be, to a degree, still ever present. The risk of that is ever present, but lower now, based on models that we have, based on the history that we've had over the last couple of months. And because of that, we can feel like, hey, maybe we can open things up, but realizing, for instance, the city of San Francisco, as we speak, has 50 plus patients in hospitals across the city of San Francisco. In UCSF alone, I was just reading 6 patients still on ventilators. San Mateo County, was just in the headlines, 6 people died in the county. So the risk is still there. And we know that certain folks are at higher risk than others. And so a lot of us know these things now. And I just want to reiterate that it's important for us to weigh our re-entry into the real world very carefully.
Okay. Yeah, I think that's all wise words. We should definitely proceed with an abundance of caution. So I'll go ahead and turn it over to the city clerk now, who is monitoring the chat line. Have you received any questions?
I have yet to receive any chats, questions, or any raised hands from the participants.
Okay. So maybe at this time, since we don't have any questions, I know earlier when we spoke, Dr. Gupta, you had mentioned that there is some additional information that you have about the virus now that you didn't have a few weeks ago. And would you mind just kind of sharing with us what you know now?
Yeah, a lot of it's epidemiologic type stuff. What we're seeing, the data being presented from the big places being hit, is that folks are, the folks that are being affected disproportionately are folks that tend to be living in clusters. And we look at the cities, New York City, Atlanta, New Orleans, and we look at the demographics of folks being affected. And in addition to it being folks that are older, you've got folks with comorbidities, so we touched on this last time, but now we have a little bit more data to show that indeed high blood pressure, asthma, diabetes are amongst the bigger risk factors. Obesity is another major concern for folks being affected. And we just have more data to show that and support it. So age, and then racially speaking too, this has been affecting folks. It's hard to tease apart necessarily the fine details of causation versus correlation, but we are seeing increased African Americans, Hispanics being disproportionately affected by this condition as well. Other facts or other epidemiological concerns have to do with, again, the homeless. And this is tricky, and I'm sure a lot of us have read this or seen about this, the idea of excess deaths. What that means is, sure, we can count the folks who come to the hospital and get a nasal swab, go on to respiratory failure, and then die. So, I mean, that's an easier number to measure. But folks who are at home, who are passing away, relative over the last 2 months, we have some of that data. And comparing that to a year ago, I think that's something that's very fascinating, the degree of excess deaths. And so across the board, we're seeing that in New York City, we're seeing that here in the Bay Area, quite a number of excess deaths. What gets tricky to know is, are those COVID deaths? Or is it, again, the question of folks who are maybe necessarily nervous about going to the hospital with chest pain or shortness of breath, a known history of heart failure or heart disease, and being nervous about going to the hospital, and those symptoms get worse and worse, and then it becomes too late, and there's consequences of that. So I think that's just another data point that we're seeing more and more evidence of. On the therapeutic side, compared to where we were the last time I spoke, there was still some buzz and speculation about the use of certain therapies off-label, hydroxychloroquine, azithromycin, and we unfortunately saw, folks use that in excess. There was a story I'm sure many of us heard of, the folks in Phoenix or Scottsdale, somewhere in Arizona, where people took massive amounts of hydroxychloroquine, but in a different formulation that was in fish tank food, and ingested it, and a husband and wife passed away from that. So anyway, what I was trying to get to is we have better understanding of at least those two therapies. There are multiple studies now, still more underway, but the more and more studies that are showing us that those are not just ineffective, but it's probably more harm than good in terms of cardiac arrhythmia. So that ship, hopefully for most of us, is a well-known ship that's sailed and moving on. Other therapies, from where we were about a month ago, there's still a lot of action in terms of studies going on. Remdesivir is the big one that we got some data on about a week ago. And that was very, very promising. But not the big game changer, which we would all hope for, which is that does it prevent us from getting severely sick? What the data on the remdesivir drug showed is that for patients who were hospitalized with COVID-19 related pneumonitis or lung inflammation, you give some of those patients remdesivir, and you give some of those patients placebo, and they followed hundreds of patients to see, controlling for as many things as you can, which group of patients did better in terms of length of hospital stay, ICU stays, ventilator days, mortality. And the big news, which was exciting, on the practicing side, and actually for everyone here, is it was able to show that folks on average were on the ventilator for 15 days, 4 days fewer than the control group. So folks who got remdesivir had less severe pneumonitis symptoms and manifestations, and therefore needed less intensive care by a factor of 4 days. So is that good?
Yeah, I think that's great.
Is it the magic bullet that is going to get us out of this mess? Not even close. There's trials going on right now looking at so many different therapies, many of them the FDA approved. And I think we'll see some exciting data in the coming weeks. The vaccine information, I think, is pretty exciting. Many of you heard that one of the big trials, phase 1, and this gets confusing for a lot of folks, the steps for clinical trials. You've got phase 0, which is where you've got a chemical in a lab and you've maybe tested it on some animals. You've got phase 1, in which you get a small group of patients, and you just test it on a small group and you make sure that nothing bad happens. And then you've got phase 2, where you figure out what's the best dose necessarily for a therapy or a vaccine. And then you've got phase 3, where then you actually get to see what's the true efficacy of a therapy or a vaccine. The Moderna vaccine that's generating a lot of buzz and such has made it past phase 1, and it looks promising there. And so you'll see folks like Dr. Fauci, Dr Gupta on TV, cautiously optimistic about that. So does that mean we're going to be done with phase 2 and phase 3 soon? No, I think we still have a ways to go. But I think the vaccine, the therapies, epidemiologic data, I think are the big 3 things that I would identify as changes in what we know now rather than about a month ago.
Great.
So I have a question, Dr. Gupta. Originally, we weren't quite sure how it was being transmitted. And it seems that there's been, you know, a pretty standard rule that it is, you know, droplets from sneezes and coughs is the predominant spread. But we're beginning to hear different ideas on touch points, food, those kind of things, and how much actual transmission is going on from those items. Do you have anything to share on that?
Yeah, it's a good question. And it's so practical as we think about the phase 2 of opening up in our society, right? Like if we're going to go to a restaurant and open a door or, you know, services. So I appreciate that question. What we do know is, yes, to your point, that these are droplets. So droplets that are generated by coughing, sneezing, even talking, right? Like, and so someone who's talking quite loudly, many of you may have seen the schematic. It was on CNN. I think Dr Gupta gave this. Someone sitting in a restaurant, and it was a cartoon showing that if this person's just having a normal conversation, the degree of which even just normal talking can potentially lead to spread in a closed ventilation system. So yes, to your point, Terry, yes, the concern is droplets, how long they linger in closed ventilation systems, indoors, AC units, which some of us had to use the last couple of days. It was so hot, but maybe even potentially my Google, my Siri just picked up on that, sorry. But otherwise, in terms of surfaces, yes, droplets, as they land on certain surfaces, the virus will, from what we've seen, still stay alive for a period of time. And I have the exact data in terms of cut points. Metal surfaces versus paper-based surfaces like mail versus plastic surfaces. I don't have the exact numbers in terms of hours per day, but that's something that's that is available now based on research. And in one modicum or another, we can talk about that. But I think it is an important question. Certainly, it's on the CDC website as well. That very topic.
Great, thank you.
Okay. We do have some questions that have come in. To my knowledge, those are not related to what Dr. Gupta has discussed. So we'll go ahead and save those questions until the end. I'm sure you'll be with us through the remainder of the call. So if there are other questions, I'll go ahead and send those over your way to answer. In the meantime, we'll go ahead and move on to Mayor Terry O'Connell.
So one of the good news things that has happened is that with the help of our supervisor, David Canepa, Peninsula Family Services has a program called Got Wheels. And that program is a ride service for seniors over 70. And originally it was funded as a pilot program for the city of Daly City. They've expanded it and added another year to the program. And so now they have 25 slots that they're making available for residents of Brisbane and Colma specifically. And the participants need to be 70 years or old. And each person who gets accepted to the program gets subsidized door-to-door taxi service for $5 each way. So you can schedule it ahead of time. You can call the taxi service, and you can bring up to 3 of your closest friends with you. Only the member needs to be 70 years old, and the application process is online through Peninsula Family Services. And we also have a link to the application, and we put it out in the Star. So it's a service that it's going to be a benefit to Brisbane. The taxi service is only in their service area, which is Brisbane, Colma, Daly City, but it does include the Kaiser of South San Francisco. So that could be a real help, and that'd be 3 round trips or 6 single trips a month that are at that subsidized $5 rate. So it's something that we're really encouraging our seniors here in town to get an application for. In Daly City, over the last year, they have 78 people on the waiting list for this service. So it's in high demand. And with only 25 slots for Colma and Brisbane, we're really hoping that we can utilize that and be of help to our seniors here in town. So it is coming out in the Star, which is going to be in your mailboxes here in the next couple days. And you can go to the peninsulafamilyservices.org website, or you can contact City Hall and speak to Caroline, and she'll be able to help you with the application process and steer you to the right direction. But we're really excited that our supervisor was able to get that program expanded to Brisbane and Colma, and I hope we can utilize it.
All right. Thank you, Terry. So we'll go ahead and take some of the chat questions here. So first question is, we love local businesses here in town and are aware that some may have been materially impacted financially. Are there opportunities that the city can take to support impacted businesses? This is a great question, and this is something that, we're actively talking about. Unfortunately, we haven't reviewed the budget yet, and that's really what is going to allow us to be able to help or not help at this point. I know that the city has been, it looks like the city will be heavily impacted by COVID as well. So we may not be able to help as much as we would like. I'd love to turn that over to Stuart or Clay if they would like to add anything, and of course Terry as well.
Sure. As Madison indicates, we are looking at a couple different things, and I think those will probably be discussed next Thursday at the council meeting. There's a couple things we think we could do that are fairly small in terms of financial costs to the city, but I think could be of help to small businesses, particularly small businesses. So we've been thinking about that all along, and hopefully we'll be able to have a conversation with the city council next Thursday on that.
There was the SMC Strong Program. The application for that unfortunately has already closed, but a business from Brisbane did receive a $10,000 grant. They do not have to repay this amount. So far, over 100 businesses in the county have received $10,000 grants, and there is a long waiting list of other businesses in line to receive grants should more funding be available. So I'm hoping that there are some other Brisbane businesses that will get grants as well. There, of course, still is PPP funds that businesses can apply for if they meet the criteria, as well as an economic injury disaster loan. I know that the Chamber of Commerce sends out regular emails with resources. Those may not be city provided financial opportunities, but I know there's been lots of resources that have been provided for various grant programs, updates about important dates people should know about. So that's another resource located in the city of Brisbane that has that sort of information as well. So the next question is, have there been any confirmed cases in town? So I'd love to steer you towards the smchealth.org/coronavirus site. That is a great resource to find information relative to the data about COVID-19 that affects San Mateo County specifically. And there you'll find a breakdown of cases per city. Right now, I just checked, and Brisbane is clocking in at less than 10 cases. So because the number is so small, they're not specifically going to say it's 2 or it's 5, but right now it's less than 10. And this information was released a few weeks ago, I believe, and it was less than 10 at that time. So that's positive news that we haven't reported more than 10 cases. However, Health Officer Dr. Scott Morrow really urges us to understand that these data points aren't necessarily a clear picture of what's going on in the community. Many people go untested. And so while less than 10 cases seems low, you should be acting with an abundance of caution when you are out in public, when you are interacting in things like the supermarket. Just because it seems like we don't have many cases doesn't mean there aren't plenty of neighbors nearby that do have COVID-19. And if anyone wants to add to this, feel free to step in. The next question here is, do you know of any plans to have testing available in our area to the general public? So there is the Verily testing site, and that was created in partnership with Alphabet Company, which is related to Google. And so initially they were doing testing just at the San Mateo Convention Center. And now they are kind of doing a roaming system. So they test at the convention center. They also test in East Palo Alto, I believe. And some days of the week, they test in Daly City. So that's going to be the closest location to us. You do need a Gmail account to register. And you register online and they give you an appointment slot. And I know that the test is a swab test of the mouth. I know a lot of people were afraid about the testing that's way up in your nose, all the way to your brain, and way down your throat. So I've been told that actually it's a pretty painless test, which is the one that they're using. And they are trying to figure out a way to do walk-up testing. Unfortunately, the way that the system that they have is set up is really not lending itself to that setup so far. So I would suggest that you look at the Verily site, and Daly City will be the closest location. Clay, are you aware of specifically what days a week Verily is testing in Daly City? Is it at Ceremony or
It's
just
at
school?
Ceremony, the old school, and it's I believe Wednesdays and Thursdays are the dates that they're doing Daly City. I know that they've been booked the first couple of weeks, and so for people who are interested, get on there early and try to get your times. It might be a couple of weeks out before you actually get tested.
Okay. The next question here is, the senior benefit discussed on the call today sounds excellent. I agree. Is there a directory that lists other active local benefits? I believe that the city has a page on our website with this type of information, but I'll go ahead and pass it over to Caroline. If she's on the call, she can speak to that. We might have to unmute her. Oh, there she goes.
Hi there. So yes, there is information on our website about the Got Wheels program. And I think the question was more so about other senior programs, was it?
Yeah, just a compilation of maybe not just senior specific benefits, but maybe other programs, like could be information about Samaritan House or information about the Great Plates program, just other.
Yeah, so there is, if you go to brisbaneca.org/coronavirus, you'll go to our COVID-19 information portal that has information specific to the city of Brisbane and the county of San Mateo. So there's different food resources, and also if you need access to financial resources or information about rent and moratoriums, that's all there in that portal.
Great. Okay, I'm just checking to see if there are more questions. Also, feel free, if anyone is interested, you can use the raise your hand function, and we can call on you and you can ask your question.
Madison, I had a question for Dr. Gupta.
Oh, yeah.
So I recently graduated into the Magic 65 and older club, and I'm just curious, Thank you, I suppose. So I'm just kind of curious, what is it about aging in and of itself that makes you more at risk?
It's a great question. It's multi-layered. We know the prevalence of certain conditions increases with age. So we know as a whole that high blood pressure, as we increase in age, the prevalence of high blood pressure seems to go up. Same thing with other conditions like diabetes, cancers, and so on. It's just, there seems to be that correlation. And how that, part of that is societal and what we're eating and our activity levels, and that's part of it. I think the other part of it has to do with our immune systems and how they evolve with age too, which is why it's not just a COVID-19 thing. We see every year the flu seems to predominantly affect folks at age 60 to 65 and above, with or without those health conditions. So even folks who are healthy, our immune systems evolve just like we do in so many different ways as we age. And to that end, our ability to ward off foreign invaders as they enter our system, the T cells, the B cells, there's changes that occur on so many different mechanisms that the immune system operates. And there's just no quick, there's no easy button to fix that, right? It's just part of the natural part of aging. So it's tough. It's one of those things that as science improves, one day we'll be able to answer and maybe address that in so many different ways. But it's a great question, and one that hopefully over time we'll get better answers to.
Thank you.
I think on the, since it comes up, I'll just talk about the flip side, and I'll tell you about personal anecdotes about younger folks too. I mean, so the statistics US-wide, actually I'll even speak about San Mateo County. I think there's, the last time I looked, there were, for San Mateo County, I think 80 plus deaths, something like that. Could be off by a couple. And the majority, I think I did the calculation, is 60% or 7, it was 67% of those folks were age 70 and above, 60 and above. Sorry, I'm a little, let me speak it one more time clearly. Folks 60 and above represented 67% of the deaths to COVID in San Mateo County. What does that tell you? Okay, so the majority are folks above 60. But it should also bring our antenna go up for folks less than 60. And I don't consider 60 to 70, I don't even consider in the modern day we live in, 60 to 70 is not even that old. I really don't think, yeah. I really don't think folks in their 50s are old at all. In 40s and 30s, you know, I mean, the older I get, the easier for me it's to draw that line. So I'll put that preface. But anyway, it's just remarkable. And I talk to my colleagues in hospitals who are in the East Bay, in San Francisco, and you know, folks in their 30s who are passing away from this disease. It doesn't have a barrier to say, and I think that's the misconception for a lot of young folks. And the news, I'm sure a lot of us saw and heard, and maybe even some of us did it, went to Dolores Park over the holiday weekend, or went to Golden Gate Park. I made a drive-through with my family. We were just, you know, wanting to get outside, so we just kind of drove through and saw packed. You guys read this too, and no one I saw was wearing masks. So it's tough because you're not just taking a risk for yourself, which is most important, but then, you know, who are you going to see on your weekends? You know, potentially your parents or grandparents and stuff like that. So this is something that affects all of us, and we all, whether we're on city councils or we're physicians or we're citizens of the city or the county, have a responsibility to emphasize to people we see around us in a civil way the importance and relevance of social distancing, wearing a mask, and not to get complacent about hand washing. I mean, it's tedious for me, and I have to do it all the time for work. I don't enjoy washing my hands, but it's got to become a habit. for all of us, step outside, come in, wash hands, just to overemphasize the importance of these basic things. It's so corny. I made the joke sort of the last time I was on this, that in hospitals, physicians and nurses go through training on hand washing because it's such an important factor in hospitals in reducing the spread of infection, that we every year go through a hand washing. How do you wash your hands? How long do you do it? What's the technique? What's the method? How often? When? In hospitals, they employ people, many of you may know this, but they employ people to watch doctors and nurses coming out of exam rooms, patient rooms, to see, are they doing the hand gel, or are they washing their hands? And even in hospitals, we don't do a great job. We should be at least 80%, and frequently it's not where it needs to be. So I'm not trying to point fingers and say, oh, you know, it's something we all can do a better job with.
Very true.
Okay, at this time, I don't believe that there are any other questions. I want to thank you all for participating on what our sixth town hall. And just a reminder, if you haven't signed up already, please visit our website to sign up for our emails. We send out weekly emails from the city manager, which has information like what we just talked about with the seniors. That goes out twice a week. And then we also have a letter that goes out on Sundays from one of the council members. It rotates every week who it will be, with just some positive sort of messages about what's happening in Brisbane, as well as some things that you should be aware of. So it's a great resource of information. And without further ado, I think that's it. Thank you all for joining us. Thank you, Dr. Gupta, for sharing all of that information. It's always a pleasure to have you. And I believe that's it.
Thank you so much, Madison. You did a great job hosting the meeting. And I
Thank
hope that everybody stays safe and healthy. Thank you. Bye-bye.